So Section 2 of the Charter takes those rights that the courts and our common law tradition say that we already have, but it codifies them so that there will be no misunderstanding by any government department that these are fundamental health rights that Canadians have. And one of the first ones set out in Section 2 is basically that we have the right to make our own health decisions, that we have sovereignty over our own bodies, and that our right to make personal health decisions, that is a right that we have without state interference. Because it's all fine and good to say we have the right to make our own health decisions, but if in practice the state keeps interfering with that by taking treatments that we want to access away, then really we don't have that right at all. And then another thing is that it entrenches that the state cannot take away a treatment that we want to have access to unless the state has evidence that it poses a significant risk and that taking it away will not create a greater risk. Because one of the difficulties that we've had with Health Canada is they will identify a trivial risk on a product and then basically take it away without asking the logical question, well, is there any risk of taking the treatment away? And at times they've acted very dangerously. An example that comes to mind is natokinase, which is an enzyme used to thin blood. And when Health Canada took natokinase away for really just an imagined risk, and just by way of comparative, it's completely legal in the United States and is being sold without any difficulty, but Health Canada identifies a little risk, but they did not do a risk analysis. What's the danger of taking natokinase away? And I know that many medical doctors were very concerned because they were successfully treating their patients with natokinase, and when that was taken away as a treatment option, they had to move their patients to the more dangerous chemical drug model. And we just want common sense. If you're going to say we can't have access to a treatment, you better not be causing more harm than good, because the purpose of drug regulation, the purpose of privileging our rights is good health outcomes.